Good afternoon, ladies and gentlemen, and welcome once again to Fertility Focus. This comes to you every Thursday at 6 p.m. and it's an initiative of Clearview Hospital, Lekki Phase 1. For those of you that have always joined us, I thank you once again for coming, and for the new people joining us today, welcome. So today's topic really is safe options in the management, or safe options for the management of uterine fibroids. A lot of you have heard about uterine fibroids, and I'm sure I know a lot of people are tired of people talking about uterine fibroids all the time. But it's something that is with us. It's going to be with us for a very, very long time, because many of you know it's a disease of black people. So a lot of black people actually are more predisposed to having them because we are black. It's topical, and it's something that we need to talk about. So as a way of definition, what are uterine fibroids? Uterine fibroids basically they are tumors or growths from the wall of the womb, and they come in different sizes, and they are located at different parts of the womb. If they are within the wall of the womb, we call them intramural. If they are projecting into the womb, into the cavity of the womb, we say they are submucous or subendometrial. If they are projecting out into the pelvis, we say they are subserous. So they can occupy different positions. Some of them can even be on the cervix, that we say is cervical. There are some fibroids that have been known to get blood supply from the intestine. We will call those ones parasitic fibroids. And I think the largest parasitic fibroid I have seen is about 18 kg. And I did that with a general surgeon somewhere in Lagos here. Several years ago. It weighed 18 kg, you had to put it in a bucket. And that one had taken blood supply from virtually every part of the intestine. But we did it, and the patient went home very, very well. So, how common are uterine fibroids? Uterine fibroids are, in a recent study, they were said to affect 50 to 60% of women, and that number increases to about 70% in women over 50. So you can imagine that about 6 to 7 in 10 women within the reproductive age group will have fibroids, and about only 30% of those people will have symptoms, which is good. So a lot of people actually have, like 70% of people will have fibroids, but they will never have symptoms. And what do I mean by symptoms? The symptoms could be abnormal uterine bleeding, which is very, very common. So a woman with fibroids sometimes would have excessive bleeding during her menses, which we call menorrhagia. She might even bleed in between menses. Some will call it intermenstrual bleeding, metrorrhagia. And then some of them will also present with pain. So fibroids sometimes, even when they don't generate, they can undergo torsion and give pain. And that pain can be so bad and debilitating that the patients are not able to function the way they should. And then the last on the list is pressure symptoms. What do you mean by pressure symptoms? So a woman with uterine fibroids sometimes may have pressure on the bladder and needs to go and urinate or wee all the time. The pressure can also be on the rectum, and such women will have constipation, and the pressure can be so bad sometimes that they even have problems having sexual intercourse, because any small movement within the pelvis gives them severe pain. And the fibroids can also be so bad that they affect pregnancy. What do I mean by that? Fibroids can predispose to miscarriages, and then they can also lead to preterm delivery. So if the person doesn't have miscarriage early in pregnancy, she may have a miscarriage later in pregnancy. And sometimes fibroids can cause malpresentation. What does that mean? Malpresentation means that the baby, instead of coming with the head, might not be able to present with the head. And such women are now prone to having instrumental delivery, or even cesarean section. And sometimes because of the fibroid, the womb might not even contract the way it should. And if there's no contraction of the womb, the woman might bleed so much that she requires blood transfusion. And there have even been incidents where, because of fibroids, patients lose their lives during delivery. So it's not something that we joke with. So going to the topic of the day, the topic is actually, safe options in the management of uterine fibroids. And I decided to do it in such a way that we make it, we divide them into, medical, surgical, and then non-surgical ways or options of managing uterine fibroids. So what are those factors that would make you, or that would determine what you would do for somebody that presents with fibroids? Of course, whether she has symptoms or not. So if a woman has fibroids and she doesn't have any symptom, a lot of people don't, in fact, for many of us, we don't do anything about it. We just say, watch and see. So if she's not bleeding excessively, she's not having pelvic pain, she's not having pressure symptoms, maybe she does an incidental scan and they found out that, there are fibroids there. Then if you see such a situation, it's not every fibroid you see that you want to go and deal with. Most of the time, just leave it alone and tell the woman to come back if she ever has symptoms. So those are, that is one option, like conservative management or sort of like watchful expectancy. Most people will never have symptoms. So for those ones, you would not need to touch. So what is the patient's age? A woman within the reproductive age group who has symptoms, there are ways you will manage her. And a woman who is already menopausal, who doesn't want to have children anymore, you also have a way to manage her. What is the number of the family? Are they very many? What is the size? Where are they located? Those things also determine how you will manage the patient. I'm going to break them down bit by bit so that we'll understand. Remember that I said that fibroids can be in different locations within the womb. It might be on the wall of the womb, it can be outside of the womb, it can also be within the cavity. And we have different ways of managing them based on location. So, a woman who desires future fertility, of course, you wouldn't want to take out her womb. What you want to do is to just deal with the fibroids and leave it like that. But a woman who doesn't want to have children anymore, who is elderly or who is just not interested, you can offer some form of treatment, that even though it affects fertility, will not be detrimental to our health. So, what are the medical ways, by which we can manage uterine fibroids? So it's not everybody that requires surgery. So if, for example, it's just pain the patient experiences, one can prescribe analgesics. Analgesics can be in the form of non-steroidal anti-inflammatory drugs. And these medications have also been shown to help reduce blood loss during menses. So NSAIDs There's things like diclofenac, ibuprofen and stuff. Those, all of them are, can be used to help with the pain. And if it is excessive bleeding, we can give medications that contain progesterone. So this can be, this can be in the form of tablets or injections. There is a new, I wouldn't call it new, but it's a bit more recent, medication that we give to our patients who have fibroids. And this medication has been shown to shrink fibroids and also reduce blood loss during menses. That drug is called ulipristal acetate. I think the trade name is Esmaya or something. So ulipristal acetate is a tablet that is taken daily, and you take it once a day over 3 months. It has been shown to really reduce the size of uterine fibroids. The only drawback with ulipristal acetate is that you cannot use that medication for patients who have underlying liver disease. So if you have a client who you think will benefit from ulipristal acetate, you need to be sure that the liver function is fine. But there was a time even the drug was stopped for a while to be sure that it's actually safe for women to use. Then the big one, the one that a lot of people also know, drug medications they call gonadotropin releasing hormone agonists. It's a very long thing, but what they can come as injections, they can come as nasal sprays, they can come as what else now? They can be taken orally. There are different types, and these drugs actually have been shown to also help to shrink fibroids, and they can be used for between 3 to 6 months too. These medications can be used even before surgery, because what they do is that they help to shrink the fibroids. So if the fibroids are very big to start, you can actually shrink them, and when you shrink them, it helps you with your incision. So instead of making a very large incision that comes from up to down, you can actually make a small incision in the lower abdomen, which is more cosmetic. A lot of our ladies will still want to be able to wear their bikinis after having surgery. So that particular medication helps to shrink the fibroids prior to you having surgery. And the major drawback with that is that it can give you menopausal symptoms. So a lot of women that are on it might experience hot flushes, they might experience loss of libido, they might even have at the worst bone brittleness. And also for those kind of people, and that's why we don't want to use them for too long. Just use them for a short period of time and then take the patient to surgery. And those drugs have been shown, from studies, they shrink the fibroids, they help to modify your incision, they help with blood loss, so there's less blood loss during surgery. And so they help. They help. So that's those are the available medical options for managing uterine fibroids. So I've talked about NSAIDs, that's things like ibuprofen, diclofenac, and stuff. I've mentioned progesterone, I've mentioned ulipristal acetate, and of course the generic analogs that I told you can come as injections or tablets. So what are the surgical approaches to managing fibroids in the present day? Like I told you earlier, how you manage will depend on whether the patient, whether she has a desire for future fertility, and of course age. So if a woman still wants to have children, then what you will offer her is something called a myomectomy. And the kind of myomectomy you will offer will also depend on the size and location and the number of the fibroids that the patient has. So if a woman is still desirous of pregnancy, what we usually offer them is a myomectomy. And a myomectomy basically just involves removing the fibroids from the wall of the womb and then repairing that cavity and leaving the womb intact. You are not going to remove the womb. So, in what ways can we carry out this removal? The most common way, that everybody knows in Nigeria is, the one that is the open surgery, where the woman has an incision on her tummy, and the fibroid is brought out, and we remove everything one by one. By the time we finish, we close the cavity, put the uterus back, and return. That's the most common one. And the reason why it's very, very common here is because by the time many of the patients are coming to you, the fibroids are very numerous and they are very large. But so in such an instance, you have no other option than to do it like that. But where you have a single fibroid, maybe just hanging outside like a peduncle, like a stalk, just with a stalk to the womb, we can actually do the myomectomy laparoscopically. What do I mean by laparoscopically? Laparoscopically just means putting a camera through the umbilicus, and then with the help of some other instruments, you're able to remove the fibroids with very tiny incisions. By the time you finish, you won't even know the woman has had surgery because the incisions are very, very tiny. And a lot of patients actually like that. The main problem is that by the time many of the people here are presenting, they might not be good candidates for that kind of surgery. But I can assure you that the skill for laparoscopic myomectomy exists within this country, and there are so many centers, including ours, where procedures like this can be done, and they can be done very, very safely. The other way that we can also do a myomectomy is to go through the cervix, or through the vagina into the cervix, and then actually for those ones that are within the cavity of the womb, because those ones are the ones that even cause the most bleeding, and they have also been shown to lead to poor fertility. So if I have a patient that has a fibroid that is within the cavity, I can remove the fibroids hysteroscopically. And of course, that also involves using a telescope with some working things attached to it. Once I just see the fibroid, I can actually just shave it off the lining of the womb, or cut it off, or find a way of just shredding it in a safe manner. Remove all the particles. And studies have shown that by doing this, you can even help to improve fertility. And such women actually are very happy because there is no cut on their tummy. So, nobody will even know that they've had surgery. But that surgery that hysteroscopic removal is actually reserved for those ones that have the ones that are within the cavity. And once you do that, all their symptoms tend to go, especially when you do the resection properly. So I've mentioned that myomectomy can be done by open surgery, which is called laparotomy. You can do it also by laparoscopy, which is using cameras through the abdomen with keyhole incisions, which at the end of the day you won't even see. And then the last one will be the hysteroscopic one, where you use a scope through the vagina into the cervix, no incision, just shave off the fibroids from the wall of the womb, and the patient is fine. So for those ones that are not desirous of pregnancy anymore, the conventional way would be to just remove the womb, and just like we can remove the womb laparoscopically, you can also remove it via laparotomy. What does that mean? So we can do open surgery to remove the womb. We can also put cameras and telescopes to remove the womb, and by the time you have finished your procedure, the good thing about hysterectomy is that once it's done, it's done. There's no risk of recurrence because the womb is not there anymore. The only drawback is that the patient does not menstruate anymore, and if she wants to ever have children again, then she will need to consider surrogacy. So those are the conventional ways, by which we manage uterine fibroids. But there are some newer techniques also that are coming into play now, and they are available here in Nigeria. So and some of these procedures are actually alternatives to myomectomy and hysterectomy. Myomectomy, like I told you, is removing the fibroids and leaving the womb behind. Hysterectomy is taking out the womb entirely. Okay? So what are those alternatives? So in Nigeria presently, there are one or two people that use scans and other things to do something called uterine artery embolization. It's a big word, but what it just means is that you are using some agents to block blood supply to the womb. So by the time you go to the artery that supplies the womb and you put something to block it, what happens is that the fibroids don't get good enough blood supply, so they shrink. And of course, when they shrink, the patient's symptoms also improves. So she has less bleeding during menses. Because the fibroids shrink, the pressure within the pelvis also reduces. The only drawback, is that it's not a kind of procedure you can do for everybody, and there are still some concerns, about using that technique for people who might still want to have babies. Remember that you are cutting off blood supply to the artery that supplies the womb, and it's that same womb that is going to be carrying pregnancy. So it's always advisable to, have a good talk with whoever is going to be doing that procedure before going ahead. There is also something called high intensity focused ultrasound. That one too just came into Nigeria, and I think it's just one center presently that does that. And what they do basically is that they use ultrasound beams, like sound waves, to sort of fry the fibroids so that they reduce in size. It's available here, and of course, like I said earlier, it's not for everybody. It might not work for everybody. And if you have fertility, as your concern, then I'm not sure if that would be the right way to go. But it's good to just have a talk with whoever it is that's offering you that service, so that you'll be clear in your mind what to expect. There's no procedure that doesn't come with complications, so you will need to be very, very careful. So I have a question here. Somebody says, I heard that big fibroids bleed a lot. What can be done to prevent excessive bleeding during surgery? This is like an exam question, and if you go for an exam and you are training to be a gynecologist, it is what the examiners will ask you. So how do we prevent blood loss during surgery? The first thing we do is that we make sure that the patient is optimal. Optimal meaning that by the time we are checking our blood level is even fine to start with. So good PCV, other parameters within normal limits. She's not sick. There's no evidence of infection. By the time she's optimal, you know that your problems are reduced by 50%. The next thing is we try to make sure that we don't do the surgery during the time she is having her menses, because the stress of surgery with the added stress of having menses can lead to increased blood loss. Then remember that the pelvis is also very, very congested during menses. So as gynecologists, we are advised not to perform myomectomies during or surgeries during the time the patient is having a menses. Then when we get inside, as part of the things we do to prevent blood loss, we put something called a tourniquet. A tourniquet is like we tie it around the womb, sort of like pressing on the artery that supplies the womb, so that the blood supply to the womb is reduced significantly. So by the time we're making our incision on the womb to remove the fibroids, there is little or no blood loss. So those are some of the ways by which we are able to prevent blood. And of course, by the time I remove the fibroids, that cavity from which I have removed the fibroids, I will meticulously close. Because if we don't close it properly, that cavity can ooze. And if the other blood that oozes out is of no use to the patient, and it can even lead to, morbidity or even mortality if one is not careful. So we take all those things as a way of trying to reduce bleeding. Another way you can reduce bleeding is before surgery, especially when you have very, very large fibroids. We give medications like that GNH analog I mentioned to you before. Those medications have been shown to help reduce blood loss during surgery. And the common ones are goserelin, Zoladex, we have leuprorelin, a lot of them that we can give before surgery. And we can do that 3 to 6 months before. So a lot of us who have seen a lot of these cases would not take patients in until we are sure that they will be safe, because fibroid surgery is no easy surgery. And remember that even in Nigeria here, fibroid surgery gets a bad rap. A lot of people just, whenever they hear fibroid surgery, they get scared because they've heard that somebody has died from it or somebody has had a bad experience from it. But where good care is taken and where the skills are not lacking, most patients, actually about 99% of patients do very well. And there are a lot of fibroid surgeries going on in Lagos now that many of you have not even heard about. And many of those patients go home and they have good testimonies to tell others. So it's not always as bad as people paint it. So we actually do a lot of things, to prevent blood loss. Morphilis is asking whether it is true that every lady has fibroids, but just that it's worse for others. And then, not every lady, but like I said before, 50 to 60% of ladies would have uterine fibroids. And truly, not everybody will have symptoms. Only 30% of women will have symptoms. So, I hope that answers your question. And you're asking me what are the effects of alcohol and smoking? Does it make it worse? I'm not sure there's any evidence that supports that. I probably have to check. I'm not sure alcohol and smoking will make fibroids worse, but because they can be detrimental to health, the way they are, when you take it excessively, that could be. I don't know, I'll have to check. Then, can fibroids be removed or shrunk using local herbs? I've seen a lot of patients that have used herbs in the past, and paid very, very, they paid a lot of money, to try to avoid surgery. But they still end up coming back to us because many of those so-called herbs don't actually do the thing. I am not sure, because of course I'm not a herbalist, I'm a doctor. I am not sure of any single herb that can help shrink fibroids. If we can have a study where those people that administer the herbs can show us before and after ultrasound images of the fibroids they treated with those herbs, then we should be able to believe them. But if you don't publish anything and you just keep telling people to take different things in order to shrink fibroids, you might end up causing more problems for the patients, than you intended. There are patients I have seen who have inserted some herbs into the vagina in order to sort of expel the fibroids through the vagina. And they've ended up with very, very bad injury to the vagina, something called gynaectasia. I have seen not one, not so many, and at the end of the day, what we end up doing for them is some form of plastic surgery, what we call it vaginoplasty. They try to open up the vagina again, and that we do in conjunction with a general surgeon, a plastic surgeon. And then we still do the fibroid surgery. So somebody is working from under, and we are working from on top. It's not easy surgery. And for somebody who is trying to avoid surgery, now having two major surgeries in one, it's really not worth it. So I would advise anybody who is thinking of using herbs to at least visit a gynecologist or somebody who at least knows what he or she is doing. Because, a lot of these things have been shown to be harmful. I'm not trying to call anybody out. It's not my place to do that, but anything that you're going to do, should be evidence-based. Don't say, they told me. No, it's not that I'm telling you. Have you seen it really work? Who have they really treated? Can they show you before and after pictures of the people that they've treated? Can they show that it's the same person that they treated that now has shrunken fibroids? So you need to always be sure before doing those things. But like I said, I don't know of any single herb that can shrink fibroids. So please, let's be guided. Somebody was just asking whether we can do fibroid surgery during pregnancy. No, the answer is no. Nobody will no trained gynecologist will touch your fibroids when you are pregnant. We will wait until after pregnancy before doing anything about the fibroids. If you are pregnant and you have fibroids, what we try to do is to manage you, till you deliver. And once you deliver, maybe after 6 weeks, if you are still interested, you can come back for surgery. So, I think that's about all. I don't know whether there are other questions. Let me see. Okay, I think that's about all. I don't know whether I have another question here. So somebody is asking me whether a woman can conceive even with uterine fibroids, and the answer is yes. If a woman, there are a lot of women that have uterine fibroids, and they get pregnant with the fibroids, and they get delivered normally, even with the fibroids. So it's no big deal. Fibroids on their own don't cause infertility. But, it's only if we have looked for other causes of infertility that we cannot find that we now start managing the fibroids. And like I told you, there are so many different ways of doing that. But a lot of women, even with huge fibroids, get pregnant and they go on to have very uneventful pregnancy and delivery. I don't know if there are other questions. So, I think we've done about 30 minutes. If there are no other questions, I'll just want to say thank you once again. It's been a pleasure having you all here. And next week also promises to be interesting. So if you have questions, you can always drop them and we'll find a way of answering them during the next session. So I'm actually at Clearview Hospital, Lekki Phase 1, and I'm at the Fertility Hub within the same building. I decided to use the backdrop today just to show you that it's not so it's not only deliveries that we do. We also if you come in, there are so many things, so many services that we offer, and it doesn't have to be expensive. We mentioned before that we have an arrangement with Access Bank, the W community, and what they do is that they provide financial support for people who might require maternal health services. And this could include surgeries for fibroids, it could include IVF, it could even include delivery, and postnatal care. So if you think that you want to take advantage of this, then you can come in and have a talk with people. If you can't come in, you can also call 0702 500 8035. The process is very, very easy. If you provide, a letter of introduction, it tends to move really fast. A lot of people have actually taken advantage of that, and thankfully we've been able to assist in our own little way. For those of you who might have questions about your fertility, we have fertility assessment packages. So come in or call 0702 500 8035 to make inquiries, on about fertility assessments and find which one works for you, because there are different types. There's the bronze, silver, gold, and platinum. So come in, let's have a talk. And of course, we have regular antenatal classes for pregnant women. And if you are if you're pregnant and you think that you want to come in to have your baby with us, then I suggest that you register for antenatal care with us. For those of you who have HMOs, we are in partnership with AXA Mansard, THT, Philips HMO, Leadway. There are quite a number, and because these people have seen that we provide quality service and we do that in a cost-effective manner. We don't want to make it all about the money. It's quality care at little or no cost. So join us next week for Fertility Focus, and like I said before, it promises to be a very interesting one. Thank you very much for your attention. I am very, very grateful. Thank you.